When should you seek medical help concerning infertility, also called fertility evaluation? Fertility evaluation are the tests and examinations that a doctor is going to do on you to try to understand or elicit what could be the cause of what? Infertility. Please remember to go for fertility evaluation as a couple. Before you go for fertility evaluation, have this in mind. A woman aged 35 years and below, you should have had regular and protected sexual intercourse for a period of 1 year. Those are 12 months. And a period of 6 months for a woman aged 35 years and above warrants you to go and see what? A doctor. A woman aged 40 years and above and wants to venture into the journey of getting pregnant or has been trying to get pregnant, please seek for medical help before you go any further. So let's look at other factors which you should consider before you go see a doctor. We shall divide them into female and male factors. Among the female factors, the most common cause of infertility is ovulation problems. How do you know you have ovulation problems? Ovulation is when the egg is released from the ovary ready for fertilization. So when that does not happen, it means fertilization is not going to occur and definitely you're not going to get pregnant. So how do you tell? But for ovulation problems, the most common symptom is irregularity in your cycles, whereby you have a very prolonged cycle or you have a very short cycle, and you cannot predict when you're going to have your next period. What causes ovulation problems? 1. Ovulation is controlled by hormones. So if you have hormonal imbalance, it simply means your ovulation is not going to occur as smoothly as it is supposed to be. Other conditions like thyroid problems, hypothyroidism or hyperthyroidism, when you have problems with your thyroid gland or thyroid hormones, it's also going to affect your ovulation. The other one is hormones in the body like prolactin. There is a hormone which controls the production of milk when you're breastfeeding, when a woman is breastfeeding. So sometimes this hormone is high even in normal people who are not breastfeeding. So it can affect your ovulation. Other factors include overweight or obesity. And there is one condition called Cushing's syndrome. So all this will affect the hormones, how your hormones balance in your body, and in turn disrupt your ovulation. So when ovulation problems occur, you should be able to seek medical help appropriately. The other factor is when you have been treated for fertility before. This simply means you have to go for another medical evaluation before you proceed in trying to get a child. The other condition is endometriosis. Endometriosis is when the inner lining of the uterus, what we call the endometrium, which sheds every month. When that inner lining goes into other parts of the body, including the uterus itself, outside where it's not supposed to be. That is what we call endometriosis. It can occur in your ovaries, it can occur in your uterus, which will give you poor ovulation if it occurs in your ovaries, or it gives you very, very painful periods in case it occurs in the uterus outside where it is not supposed to be. Yes. Among the other signs that you should look out and should tell you whether to go to see a doctor is recurrent miscarriages, which is if you have gotten pregnant and lost it before the age of 28 weeks. That is more than 2 pregnancies which you have lost before the age of 28 weeks. There you should seek for medical help before you proceed in venturing to get the child. Then among the male factors, The most common is sperm cell abnormality. The sperm has its properties which should be normal for it to be able to fertilize an egg. The third one is erectile problems. That is when the husband is not able to erect, or when he's not able to sustain an erection, so as to be able to deposit or deliver the sperm where it is supposed to be. So if you look at all these problems, if you have any of those and you've been trying to get pregnant for a long time and you have not been successful, please book your appointment with your doctor and have an evaluation done. Thank you.